Thank you for being here. My name is Michelle Clark. I am with Southern Plains Tribal Health Board, and I'll be your moderator today. Just a few housekeeping rules before we all start. Just please keep muted when you're not speaking. You're welcome to have your camera on, but it may affect your bandwidth, so therefore your video or audio. And also today we are not going to be using the Zoom chat. We'll be using the chat, the Q&A options, and the poll options in the CVent website if you have any questions for Charmel at the end. And this is a special reminder that it'll be a session evaluation at the end for you to complete. We want to provide the best trainings on topics and experience that is possible with your feedback. And I'll make another reminder of this evaluation and one more at the end of the training. And I will now introduce our lovely speaker for the day, Charmel Holland. She is currently an evaluator for C-Stilt's opioid overdose grant with Southern Plains Tribal Health Board. She is a graduate of Bennett College and the University of Oklahoma and is originally from Durham, North Carolina. She moved to Oklahoma to follow her passions of public health and social justice, knowing that communities are not in silos and therefore remediation of health ills cannot be addressed in silos. She has provided trainings in various areas with communities across the United States and abroad. So I just want to give a special thanks to Charmel Holland for being here for this training. Thank you. And I will hand it on over to her now.
Well, great afternoon, everyone. Everyone had a great lunch and was able to join us this afternoon for about an hour and a half training. It won't be a full 2 hours, so you guys get a little of your time back this afternoon. Again, my name is Charmel Holland, and I want to throw it back to my amazing moderator, Ms. Michelle Clark. She also works on our opioid overdose grant as well. Again, thank you guys for joining us. So we will go ahead and get started. Today we will do a Naloxone Administration training. My contact information is provided on this first screen. If you have any questions or concerns after the training, you can always contact me. So today's training, we will go over facts about opioids and the opioid epidemic, how you can identify what an opioid overdose is, and about naloxone and how you can administer that to someone who may be suffering from an opioid overdose. So just a few quick definitions before we really dig in. So the first definition is what is an opioid. So an opioid is simply a controlled substance that includes, but is not limited to, heroin, morphine, codeine, oxycontin, hydrocodone, fentanyl, hydromorphine, oxymorphine, and methadone. Some of the slang terms that are used for that are oxys, perks, Vicks, smack, junk, black tar, horseshoe, and a plethora of other names as well, which we will go over later. And then what is an opioid overdose? Opioid overdose occurs when someone takes too many opioids, or any of the above listed, that the body basically goes into passing out and has very slow breathing or no breathing at all. And then the complications that occur from that is eventually death. So who is at risk for an opioid overdose? Anyone who is prescribed any type of opioids for pain control and pain management are at risk for an opioid overdose. Young people who are experimenting with drugs or have drug dependence, and then those long-term drug users who often had some type of abstinence from either rehab, prison, or they're going through some state of recovery and not realizing that their usage tolerance has now decreased because of the absence of their drug usage. And people who are prescribed opioids can be anyone who is as a young kid to an elderly person, 65 and older. There is no limit to the age limit for someone to be prescribed an opioid. So, some facts about opioid use. First, I'm going to talk about some that overall in the United States. So the drug opioid is now the leading cause of injury deaths in the United States. So it is actually above accidents as well. Opioid prescription painkillers account for about 80% of those deaths. And it's estimated that 2.1 million people in the United States struggle with an opioid use disorder. Every single day, 115 Americans die from an opioid overdose. So that's about one person every 12.5 minutes, which simply states that pretty much by the time this presentation is ended, there will be a lot of people who have passed away or have potentially passed away from opioid overdose. But we're going to talk about a life-saving drug that can actually prevent those deaths from happening. In 2017, President Trump declared that an opioid overdose was actually, in fact, an epidemic with a public health epidemic. In Oklahoma in particular, opioids are the most common class of drug overdose deaths within the state. And in 2016, 54% of all overdose deaths in our state involved an opioid. In 2016, the number of overdose deaths involving opioids was 5 times higher than that in 1999. And on average, 1 Oklahoma dies every single day. Some more update information on that also is that in 2020, there were 733 drug overdose fatalities within the state of Oklahoma, which was an increase of 24% from 2019. So as you can see, during the pandemic, we had a large increase of drug overdoses, and that's primarily because people were inside. So these are some common names for opioids. Some of them you may have heard of, some of them may be entirely new to you, or some of them you may not have even known that they were in fact opioids. So the generic name, hydrocodone, so Vicodin, Loratab, Norco, Zyhydros, Rebuzon, Oxycodone, Percocet, Percs, Oxycontin, morphine, fentanyl, hydromorphine, oxymorphine, codeine, Tylenol with codeine or Tylenol number 3, Demerol, methadone, and perforin, also known as Suboxone. So we're just going to do a quick knowledge check. And if you go over to the CVent application, or if you're already in the CVent application, you will find the poll in that right-hand corner of your screen. And you can just check all that apply that you believe are considered opioids. And all of these may not be listed. And I will give you guys just a couple minutes to see that poll. And Michelle, if you could tell me once you see a mass number of them, because I am unable to see it on my screen.
Looks like everyone so far has responded with heroin.
Okay.
Oh, 1 for acetaminophen. Okay. So yep, so far we have 4 for heroin, 1 for acetaminophen.
All right. And we'll give it about another 60 seconds in case people are having trouble finding the poll.
Okay, it looks like 88% of people said heroin and 1 person said acetaminophen.
All right, yes. So heroin, methadone, and Percocets are all, I'm not sure if Percocet was on that particular poll, but those are all considered opioids. So you guys are correct. someone raise their hand. Can't.
Oh. Hi, whoever raised their hand, if you have a question, we are going to have a question section at the end of the training, or you can go to the chat in the CVent app and website, and you can put your question in there and we will get to it. Thank you so much.
I'm not sure how to use it.
There we go. All right, moving right along. So we have a few. Okay, I'm back. All right, so we have a few more definitions. This is specifically about epidemic. So an epidemic refers to an increase, often sudden in the number of cases of a public health issue above what is normally expected in the population in that particular area. So in a 17-year period in Oklahoma, we saw a 5-fold increase in opioid-related overdose deaths. And epidemics occur when agents such as opioids, as a receptor host, the opioid user, are present in adequate numbers, and the agent can be effectively conveyed from a source to the successful host. So in 2013, the Centers of Disease Control and Prevention reported that Oklahoma had a higher rate of mortality in opioid use than the national average, which made us be considered that we had an epidemic within the opioid crisis. Considering that nationally deaths involving opioids were more than quadrupled since 1999, this shows an extreme impact within the state. Oh, there we go. So fentanyl is a synthetic man-made opioid that is about 50 times more potent than heroin and 100 times more potent than morphine. Fentanyl is prescribed through dermal patches, tablets, lozenges, as well as injected and nasal sprays. However, it is more commonly found illegally and usually mixed in with drugs such as heroin or cocaine because it can be found in a white powder substance as well. And there has been a 170% increase in the number of fentanyl deaths from 2019 to 2020. With more fentanyl overdoses deaths appearing to involve illegally or illicitly manufactured synthetic drugs. So again, fentanyl is a synthetic opioid. It's usually treated for severe pain such as cancer or other chronic conditions. And it's seen as the most recent synthetic opioid deaths, as I just stated, with the 170% increase of deaths for it. So between 2014 and 2015, actually increased 196%. And since then, it's been another 170% increase with fentanyl deaths across the United States. Again, it's often mixed with heroin or cocaine, with or without the user's knowledge, but it's extremely potent. So just again to break down the way the two different substances look, the pharmaceutical fentanyl, it is prescribed for severe pain or end-of-life palliative care. It's usually a syringe inserted or transdermal versus the illegal or illicit fentanyl, which is a substance powder and pressed down to look more like cocaine and mixed in with cocaine or heroin. So how does an overdose occur? So the opioids are going to suppress the urge for a person to breathe, and it's going to make their breathing slow down. The carbon dioxide levels are going to increase. That person's breathing is going to stop. The oxygen levels are going to decrease, which is going to cause a lack of oxygen to the brain, which will eventually cause brain damage. The process takes time, but the heart will eventually stop. And then there's no time to respond. There is time to respond, but no time to waste because death is the ultimate outcome of an overdose. But again, that is why we will learn about this life-saving drug. So how can you identify someone who is really high versus someone who is actually going through an overdose? So someone who is really high, they're going to be nodding, they're going to be able to be arisen, they're going to have some slurred speech. If they are speaking, they may be sleepy or intoxicated, but they are actually breathing about 10 times per minute. And then their pupils are going to be 10.5. Now, with an overdose, that also will have pinpoint pupils as well, but they will not be able to be woken up. Their breathing is going to be either very infrequent or they're not going to be breathing at all. Their breathing will be slow to stop. They'll have less than 10 breaths per minute, which on average you usually breathe about 20 times per minute. And you may hear like a choking or a gargling sound. Their lips and fingertips could also be turning blue. And the way to help them with that is to give rescue breaths and then give naloxone. All right, so we will move on to our second knowledge check question, which you can find in the poll as well, in that right-hand corner on the CVents app or website. And you will just check all that apply for this one as well. And so what are the signs of an overdose? And if anyone needs me to slow down or elaborate on anything, you can just put it in the chat box and Michelle can let me know, because I do have a tendency to talk a little bit faster.
All right, people are still taking the polls, but right now we have 5 responses for slow and shallow breathing, 5 for cannot wake up, 3 for tiny pupils, and 5 for slow heart rate, low blood pressure. Ooh, tongue twister. Okay.
Okay, we can give it about another 60 seconds or so.
Okay, it looks like the polls have slowed down a little bit. We have 28% that said slow and shallow breathing, 27% said cannot wake up, 18% said tiny pupils, and 27% said slow heart rate, low blood pressure.
All right, well, you would all be correct. All of those are signs of an overdose. All right, so before we actually get into how to use Narcan, how to use naloxone, I want to inform you guys that there is the Oklahoma Good Samaritan Law, which simply states that it protects you from any type of civil damages or any type of liability, meaning you can't be arrested if you help someone in an overdose situation. So this is for first responders, medical professionals, anyone off the street, a friend, a family member, even if you also are in possession of drugs or paraphernalia at the time. So any person who performs CPR or first aid, any person who offers their homes as refuge to those in need as well. So they have an Oklahoma State Bill 1367. which the peace officers has a contact with the person because the person requested emergency medical assistance for an individual who appeared to be in need of a medical assistance due to the use of a controlled dangerous substance. So any type of opioid or heroin or cocaine. And the person requesting information remains at the scene and cooperates with the emergency medical assistance personnel and peace officers. Again, you are immune from any type of criminal prosecution for possession of a Schedule 1 or a Schedule 2 controlled dangerous substance. So don't be afraid to help someone in need, be out of fear. There we go. So Narcan, also known as naloxone, it simply is it goes in a box like this. I don't know where my screen is, but it knocks the opioid off of the opioid receptor. So basically no opioid equals no effect. It's not harmful if there are no opioids in the system. So even if you don't know if someone is having a drug overdose or an overdose from opioids, you can still give them Narcan and it will not have a negative effect on them at all. In fact, I wouldn't recommend it, but you can actually take Narcan yourself and it won't do anything to you as well. It works in about 1 to 3 minutes and lasts about 30 to 90 minutes in the person's system. And again, you cannot abuse or overdose on Narcan. So what to do when you're responding to an opioid overdose? We're going to go through the list of steps and how you can actually help someone in the event of an opioid overdose. And again, this could be anyone, a friend, a family member, a colleague, anyone who you are around that you may run into who may be experiencing an opioid overdose. So the first step you should always do be to contact emergency services. And the reason you want to do that is because Narcan only works for that 30 to 90 minutes. So you want to make sure that they are aware and on their way to help you. So you're going to call 911 immediately. If you are alone, just as you would with CPR, if you're alone, you're going to call 911 yourself, put them on speakerphone while you're performing the response steps. If another person is with you in the room, have them call 911 while you perform the response steps as well. So you're going to perform, the first thing you're going to do is perform a sternal rub to attempt to arise the unconscious person. And that simply is right here in the middle of your chest. And you're going to simply rub up and down pretty hard so that you can try and get them to respond. If there is no response, you're going to follow the steps and administer naloxone. And the steps are actually also on the naloxone box inside the kit as well. So you don't have to panic like, oh, I don't remember what to do, because they are right there for you as well. So it's recommended that you actually start with rescue breaths. So you're going to verify that the airway is clear, that there is nothing blocking their airway. You're going to perform a head, tilt, chin, lift, and pinch the nose closed. I'm going to perform those initial rescue breaths and repeat one breath every 5 seconds for 1 minute. Also, while you're on the phone with 911, they also should be able to walk you through those steps as well in doing that process. So if you have no improvement, I'm going to administer naloxone into the nasal cavities and then continue those rescue breathings. If the person does not respond within 2 to 3 minutes, you can actually give that second dose. Each box comes with 2 doses of naloxone. You'll give that second dose and continue the rescue breathing. And then you're going to place them in the recovery position once they begin breathing on their own. If breathing does not return, you're actually going to begin CPR. And if you do not know CPR, the emergency representative can actually walk you through the steps to performing CPR as well. This is essentially showing you what I just said in a visual so that you can actually see it. Of course, that overdose recovery position, you're going to tilt the head back, lift the chin, open the airways. You're going to turn them on one side, place their hand against their chin, bend their knee against the floor, tip their head back, and then restrict their breathing. And you would have already call emergency services as well. And you're going to essentially wait until they arrive. And you're going to continue to breathe, do the breathing, make sure that they're breathing and support their breathing once you give them naloxone. And again, if no breathing happens, then you're going to initiate that CPR if indicated. So we have some do's and don'ts when administering for an opioid overdose. So the first thing you're going to do, you're going to support the breathing by performing those rescue breaths. You're going to put them in that recovery position, as you can see at the bottom, and you're going to stay with that person and keep them warm until emergency services arrive, because you don't want to, oh, the person is breathing, all right, they're fine, I can go about my day. No, you actually want to make sure that you stay there with that person until the EMTs arrive on the scene. You do not want to forcefully stimulate the person, so don't slap them or shake the person and try and wake them that way. Please do not put them in a cold bath or a cold shower. Don't inject any substances into them, any salt water, any milk, any type of other opioid, speed, heroin, etc., in an attempt to try and reactivate them that way. And please do not make a person vomit. This is a video that is essentially going to show you exactly how to use naloxone and the steps to follow.
Epidemic levels. According to the Centers for Disease Control and Prevention, overdoses have reached epidemic levels. Anyone who is exposed to prescription or illegal opioids, such as fentanyl and heroin, is potentially at risk of experiencing an accidental, life-threatening overdose. But what happens during an opioid overdose? Due to their effect on the part of the brain which regulates breathing, opioids in high doses can cause people to experience signs of breathing problems and severe sleepiness or not being able to respond, potentially leading to death. Narcan nasal spray is the first FDA-approved nasal spray for emergency treatment of opioid overdose. Narcan nasal spray is not a substitute for emergency medical care. Repeated doses may be necessary. As with any drug, you need to be aware of important safety information concerning its use. Please pay particular attention to the indications and important safety information during the course of and at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray was designed for use in emergency overdose situations, including emergency overdose situations outside of healthcare settings by not only first responders, but also in an opioid emergency by loved ones, friends, caregivers, and others without specialized medical training in accordance with the instructions for use. Narcan nasal spray is to be given right away and does not take the place of emergency medical care. Get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. When Narcan nasal spray is administered to a patient with signs and symptoms of an opioid emergency, naloxone molecules travel through the body to the brain. Naloxone molecules attach to the receptor sites with a greater affinity than most opioid molecules. By displacing the opioid molecules, naloxone can rapidly reverse the potentially life-threatening effects of the overdose, specifically respiratory depression. If the person does not respond by waking up to voice or touch or breathing normally, or the signs and symptoms of an opioid emergency have returned after Narcan nasal spray has been given, give another dose in the alternate nostril using a new Narcan nasal spray and watch the person closely until emergency help is received. Additional doses may be given every 2 to 3 minutes until the person responds or emergency medical help is received. Narcan nasal spray is not a substitute for emergency medical care. Repeated doses may be necessary. Remember to always get emergency medical help immediately after the first dose of Narcan nasal spray, even if the person wakes up, because the signs and symptoms of an opioid emergency can return. Narcan nasal spray 4 mg ensures that a consistent, concentrated 4 mg dose of naloxone is delivered for the emergency treatment of a known or suspected opioid overdose. Talk to your doctor or pharmacist today. Please see indications and important safety information at the end of this video. Indications and important safety information. What is Narcan nasal spray? Narcan nasal spray is a prescription medicine used for the treatment of an opioid emergency, such as an overdose or a possible opioid overdose with signs of breathing problems and severe sleepiness or not being able to respond. Narcan nasal spray is to be given right away and does not take the place of emergency medical care. Get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. Narcan nasal spray is safe and effective in children for known or suspected opioid overdose. What is the most important information I should know about Narcan nasal spray? Narcan nasal spray is used to temporarily reverse the effects of opioid medicines. The medicine in Narcan nasal spray has no effect in people who are not taking opioid medicines. Always carry Narcan nasal spray with you in case of an opioid emergency. Use Narcan nasal spray right away if you or your caregiver think signs or symptoms of an opioid emergency are present, even if you are not sure, because an opioid emergency can cause severe injury or death. Signs and symptoms of an opioid emergency may include unusual sleepiness and you are not able to awaken the person with a loud voice or by rubbing firmly on the middle of their chest, breathing problems including slow or shallow breathing and someone difficult to awaken or who looks like they are not breathing. The black circle in the center of the colored part of the eye is very small, sometimes called pinpoint pupils, and someone difficult to awaken. Family members, caregivers, or other people who may have to use Narcan nasal spray in an opioid emergency should know where Narcan nasal spray is stored and how to give Narcan nasal spray before an opioid emergency happens. Get emergency medical help right away after giving the first dose of Narcan nasal spray. Rescue breathing, or CPR, may be given while waiting for emergency medical help. The signs and symptoms of an opioid emergency can return after Narcan nasal spray is given. If this happens, give another dose after 2 to 3 minutes using a new Narcan nasal spray and watch the person until emergency help is received. Who should not use Narcan nasal spray? Do not use Narcan nasal spray if you are allergic to naloxone hydrochloride or any of the ingredients in Narcan nasal spray. What should I tell my healthcare provider before using Narcan nasal spray? Before using Narcan nasal spray, tell your healthcare provider about all of your medical conditions, including if you have heart problems, are pregnant or plan to become pregnant. Use of Narcan nasal spray may cause withdrawal symptoms in your unborn baby. Your unborn baby should be examined by a healthcare provider right away after you use Narcan nasal spray. Are breastfeeding or plan to breastfeed. It is not known if Narcan nasal spray passes into your breast milk. Tell your healthcare provider about the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Narcan nasal spray? Narcan nasal spray may cause serious side effects including sudden opioid withdrawal symptoms. In someone who has been using opioids regularly, opioid withdrawal symptoms can happen suddenly after receiving Narcan nasal spray and may include body aches, diarrhea, increased heart rate, fever, runny nose, sneezing, goosebumps, sweating, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, stomach cramping, weakness, increased blood pressure. In infants under 4 weeks old who have been receiving opioids regularly, sudden opioid withdrawal may be life-threatening if not treated the right way. Signs and symptoms include seizures, crying more than usual, and increased reflexes. These are not all of the possible side effects of Narcan nasal spray. Call your doctor for medical advice about side effects. The risk information provided here is not comprehensive. To learn more, talk about Narcan nasal spray with your healthcare provider or pharmacist. The FDA-approved product labeling can be found at www.narcan.com/pdf/narcan-prescribing-information.pdf or 1-844-4NARCAN. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including the patient information for Narcan nasal spray. According to the
All right, so after you administer naloxone, some patients may have some possible side effects, not all of them, and some may not have any of them. But agitation, some may feel nauseous or vomit, and they have excess sweating, a runny or bloody nose, extremely fast heartbeats, and even high blood pressure. So that is why it's also important that you stay with the person until EMS arrives and or they are medically transported to the hospital. Obtaining naloxone. So upon the completion of this training, you actually will receive 2 boxes, well, 1 box with 2 kits of naloxone in it. You should use your naloxone, or if it expires, you can contact Southern Plains Tribal Health Board for a replacement kit. And we will ask you to fill out a usage reporting form to secure your replacement kit as well. Most of the naloxone is good for at least 2.5 to 3 years. It will have an expiration date on the top. And you should also be able to be recertified with the administration of naloxone every 2 years. Now, the storage of naloxone, although you would want to have it with you at all times, it is not advisable to actually just leave it in your car due to the extreme temperatures that we do have here in Oklahoma as well. Don't leave it in your car overnight due to getting too hot or getting too cold. And do not open the packet unless you are ready to use it on a victim, and try and protect it from direct sunlight if possible. But you can carry it in your purse or in a backpack, so you can have it on you. Just try not to leave it inside of your vehicle. All right, this is just another little quick video that I like, and it's just about not forgetting your naloxone when you go out into public.
Okay. Getting ready, we all have our routine. Finding an outfit. Fixing your hair. Okay. And all the other little touches. Gum, check. Keys, check. Phone, check. Okay. But of all the things you remember to bring with you, naloxone could be the most important. It can reverse an opioid overdose. You can get it without a prescription in most states, and it's really easy to use. If you or someone you know is at risk for opioid overdose, naloxone could save their life. Keep it on you and at home. For more information about naloxone, visit cdc.gov/stop-overdose. Okay.
Okay, so thus far you have already learned about naloxone, about opioid overdoses, and about how to administer Narcan nasal spray. So the next couple slides are simply some frequently asked questions that I've been asked from other trainings, or that I've heard asked on other trainings that I've been a part of, and how they can be answered. So the first question is there an age cutoff of naloxone administration? And the answer is simply no. It can be given to any child or adult at any age. There is no age limit on naloxone. What happens if I accidentally expose myself to naloxone? Absolutely nothing will happen to you because there is no side effects for you if you have not been exposed to an opioid. If it gets on your skin or your mouth, there is absolutely no effect for you. It works in about 2 to 3 minutes on average, and it lasts for about 30 to 90 minutes in the person's system. And again, you can give multiple doses. What do you do if someone is suspected to be pregnant? It is safe to be used with a pregnant person. However, they should follow up with emergency care, as they stated in the video, just to ensure that the baby is okay and not suffering from any type of withdrawals themselves. If it is unknown why someone is down and unresponsive, should I give them naloxone? And the answer is simply yes, just because there are no negative side effects, no real negative side effects for someone who is given naloxone, even if they don't need it. So yes, naloxone should be given to someone who is found unconscious, because you would rather be safe than sorry at the end of the day. What will happen if naloxone is given to someone who did not have an opioid overdose? As stated above, naloxone will not harm someone if they have not overdosed from opioids, and can only help them if that is the problem given. Can dogs be given naloxone? I've asked this question before because there have been cases where dogs have gotten into medication or have gotten into opioids and have become unresponsive. So you would pretty much follow the same steps as you would in human overdose situation. You would make sure the dog is breathing, and then you perform an assisted breathing techniques if necessary. And then you would administer naloxone through their nasal cavity as well, and then repeat if necessary. So how much naloxone is too much, and how many doses can you give? There is no maximum dose. It can be given every 2 to 3 minutes until the person is responsive or emergency medical services has assumed care of that particular person. If the person starts to breathe after 1 dose, but is not fully conscious, should a second dose be given? Yes, naloxone should be given every 2 to 3 minutes until a full response of regaining consciousness and breathing 12 to 20 breaths per minute, or 18 to 40 breaths if they are under 6 years of age. And the last question that I've received, and if you guys have any other questions, you can definitely put them in the chat box or the Q&A section on CVent, I'm sorry. Does naloxone allow users to use even more opioids? And the answer to that is no. Increasing the availability of naloxone does not increase the use of opioids. It actually helps, because providing naloxone is one approach to dealing with this national epidemic. Other strategies include safe opioid prescribing practices, increasing access to medically assisted treatments or MAT programs, such as Suboxone or methadone. So just because someone carries naloxone or has more access to naloxone, it does not increase that the use of opioids or the cause of more overdoses. It actually can help them in the event of one. These are some resources, and I will leave it on this slide for a while. This is the first resource, the Center for Disease Control and Prevention, cdc.gov. Also have the phone number, Substance Abuse and Mental Health Services, or SAMHSA. We have the local Choctaw Nation FR grant, which is one of our joint grant members here at Southern Plains Tribal Health Board. They actually help with addressing opioid overdose deaths. We also have the Oklahoma State Department of Health, Recognition, Response, and Administration of Naloxone, the Overdose Detection Mapping Application Program, and then the Oklahoma Department of Mental Health and Substance Abuse Services locally, and CIT International. And then, of course, we also have the Southern Plains Tribal Health Board as well as a resource. And that actually concludes the presentation. That went a lot faster than expected. So if you guys would like me to review anything or you have any questions, I am here and available. We do have a quick evaluation, and you can either scan the QR code or it may also be in the chat on the CVent group as well. And I also see that Michelle has put it inside of the chat inside of Zoom as well for you all. And for fill out the evaluation, you will also be able to provide your email at the end so that you may receive your kit of Narcan as well. And I will check to see if we have any questions on CVent. And again, if you guys would like me to go over anything, again, I am more than happy to do that.
Thank you so much, Sharmil. This is a great presentation and such an important one too, as you showed the increasing numbers of the opioid epidemic, especially since the pandemic. So knowing this information can truly save lives. So thank you for teaching us all about how to administer naloxone. This is a reminder to fill out the evaluations for the session. There's an evaluation for the naloxone training from the SurveyMonkey as well as on the CVent. So there's two separate ones. You should be able to see the evaluation card at the end of the event at the homepage. And thank you all for attending. I'm gonna go to the CVent and it looks like we have one or two questions. What is the most common mistake in administering naloxone?
The most common mistake in administering naloxone would probably be administering it too frequently. So not waiting the full 2 to 3 minutes before administering it again.
Okay. Where can I find naloxone to provide to my community members?
So you can find naloxone, you can either find it at, you can get it online through OPIOID. You can reach out to myself here at Southern Plains Tribal Health Board, and we can connect you with someone to provide you naloxone. You can also go to, let me get the other resource for you. 1 second. I will actually provide all the resources where you can get naloxone in the chat box. Also, if you or someone you know is actually taking opioids, you can also get it from your doctor as well. They should be able to provide you with a script to be able to receive Narcan as well. And I know that from personal experience, as my mother has been on almost every opioid that I named, with the exception of heroin, every prescription opioid, I should say, due to having had a pinched nerve in her back when I was 11. I'm now 33, so she has been taking every opioid for the past 22 years. So I'm pretty familiar with Narcan.
So sorry about that, everyone. My computer just decided to crash for a second.
Okay, I will see if I can get into CVent as well to see if there are any other questions.
Don't see any other questions at this time, but this training is being recorded and the recording will be available in about 2 weeks' time. If anyone wants to review it, pass along information, thinks of anything else.
Okay, I do see another question. Let me, I don't know where it went. Okay. Mistake, When administering Narcan, what is the recovery position? I'll actually show you a picture, so it'll be easier than me trying to describe it. 1 second. I'll show you a picture of the recovery position again. All right, can you all see the screen? Oh, sorry. Okay, there we go. So this is the recovery position here. So it essentially, it's actually backwards because it should be on the opposite side of the heart, but I guess for picture purposes, it is a little off. But a hand should be behind the neck, a knee is bent in front, so it prevents the person from rolling over and essentially vomiting on themselves when they do wake up. So it is this position here.
And then I see one more question. It's from Amber Freudenberger. It says, when giving naloxone, I would just spray in one nostril. Is this correct? And the following dose in the other nostril if a second is needed.
Yes, that is correct. So you would start in one nostril, and then if they need a second dose, you would do it in the other nostril. And if for some reason they need a third dose, you would go back to the original nostril.
Okay. Does anyone have any more questions for Charmel? Let's see. Okay. A few more minutes for questions, and then, like I said, we'll provide the training in about 2 weeks as a recording. Charmel's going to be providing the resources that she listed, and we have those 2 evaluations for all of you to fill out. I have another one. So for the Narcan, how do we receive the Narcan?
Okay, so the Narcan will be received via mail. So when you fill out the SurveyMonkey evaluation, it will actually ask you for your email address. We will contact you so that we can get your address or the address that you would like your Narcan to be sent to. And that is how you will receive it. It will be received in the mail within, I would say, the next week and a half.
So fill out those evaluations. We can send you some Narcan. Okay. And then I see, Sarah, you asked if we could go over the first 10 minutes. Like I said, the training will be recorded. So if you missed a little bit, we'll be able to cover it then. And yes, the Narcan will be mailed. All right. Let's see if there's any more pending ones.
I mean, if you guys want to stick around, I got to finish a lot earlier than I intended. I can do it all over again for you. But yeah.
Well, I want to give a big shout out to Charmel. Thank you so much again for teaching us how to administer naloxone. And please fill out your evaluations. Check out the other events we have going on today. And as soon as we get your email addresses, we can start sending the Narcan nasal spray kits to you guys. So thank you all.